the Children and Families Program at the National Conference of State Legislatures. And I come in to research in this conference with what I think is occasionally a novel idea. I know it isn't, but it seems like it sometimes, that one of the primary purposes, or even the primary purpose of research, is to inform policymaking, to help policymakers make good decisions, to make decisions about programs and policies that effectively and efficiently accomplish their goals for their programs that serve welfare populations and low-income children and families. And I've been doing this work for about 15 years. And, you know, sometimes I've seen it work, and sometimes, more often actually, I've seen a disconnect. So what we want to do a little bit today is talk about that disconnect. That I think of, there's three kinds of people in this room, in one dimension anyway. Policymakers and administrators who have to make decisions about what their programs look like and are trying to make effective decisions. There's researchers who carry out researchers, whether they're in universities or research organizations or consulting firms or government agencies, that that do research, that carry out the research to look at the effectiveness of programs and what works and what doesn't. And then there's people, and I put myself in this category, intermediaries, people between those two groups of people who sometimes find themselves working with policymakers trying to bring research into those discussions. Sometimes trying to help researchers figure out how they should, what kinds of questions they should address, or how they should work with policymakers on those questions. And so I see the intermediaries, I have to admit, I'm in the middle, but my responsibility is to policymakers. So that's my interest in trying to help policymakers learn more from what research is available. And so I've observed for the last 15 years I've worked in this position. I actually used to be an academic, and trying to figure out how to bring research into that policymaking, and in observing a lot of cases where it works sometimes, and we had a brief discussion about the sweeping changes, I think on the first day, the sweeping changes in how policy changed along with the economy, along with the messaging and signaling, along with the understanding, and accomplished much more than anyone anticipated. I remember cautioning state legislators about, well, when we start the TANF program, no work program has ever gotten more than about a 10% increase. And of course, we've done much better than that for a variety of reasons, and I don't want to try to get into that. But research obviously informed the changes that were made at the federal level and then the changes that were made at the state level in a very successful way. There's other instances of that, but as I said, more commonly, there's questions about how that works and how either researchers don't succeed in communicating with policymakers, or they don't have answers to the questions that policymakers ask, or the other case in which policymakers may ignore research or may ignore information or neglect it because of other considerations that shape their decisions. I think the best way to move forward and try to bridge this, to build a connection between research and policymakers, is a discussion, is for researchers and policymakers to talk to each other. And we didn't ask to have things set up with the policymakers on one side and the researchers on the other. But when I got here, I realized it communicates, it makes sense. We want to try to, maybe halfway through we'll mix, that it's there. But I want to have a discussion, and a discussion that starts with policymakers' questions. Because I think that's one of the real challenges we have as we think about trying to help policymakers understand research so they can make better decisions. It usually starts with a researcher's presentation of the research, which often doesn't connect with the questions that the policymakers have. So the way we are going to organize this is Julie Kirksick and Don Winstead are going to ask questions, and Demetra Nightingale and Mike Fishman have to answer them. I like that. And we can start with that as a way to start, and we want to have a more general discussion about the perspectives of research and the challenges of research informing policymaking. But start with that. And I want it to be informal, so there's no presentations. Don may challenge me on this, but no PowerPoint. He has one that kind of lays out some things I think he's going to refer to, and do that. And the other thing I want to note is that I'm cheating. That in starting this discussion between policymakers and researchers, it's kind of convenient to be able to point one way or the other, that I'm cheating because I've got policymakers and researchers that have made real and successful efforts to connect policy and research. And so that, what we've got is some of the best cases and the people who have the highest level of understanding. In the course of this, we want to reach out and figure out how to include the broader audience to raise questions and points of view. But we want to start here. Very quickly introducing the other panelists. Julie Kirksick is in the Wisconsin Department of Children and Families, responsible for their TANF program. She also ran the New Hope project, a real innovative project in Milwaukee with astonishingly good results that lead us to, and the research on that leads us to some conclusions about the work. Don Winstead, who served in the, Florida Department of Children and Families, now responsible for the welfare program, but also for economic stimulus package in Florida, a small little several billion-dollar responsibility. Don has also served in the Department of Health and Human Services as the Deputy Assistant Secretary, is that the position? For Human Services Policy in the Assistant Secretary for Planning and Evaluation. Demeter Nightingale and Mike Fishman both have long histories of working with both on research and with state policymakers or policymakers generally in a wide variety of areas, and I've had the honor of working with both of them and the pleasure of working with both of them because they work successfully with policymakers. And of course, there's much more detail in our booklets about their biographies. So I want to start. I want to note something. I went up to my hotel room last night, and I had a call from Connecticut, and I had a question. And the nature of my job is if I get asked a question by a legislative staff or a legislator, I'm supposed to answer it. The question was, the governor's proposed eliminating TANF-specific workforce services. In Connecticut, the Department of Labor offers workforce services, the Job and Family Economic Success. They provide the services trying to engage TANF recipients in work. The governor has zeroed out the budget, both because Connecticut is under intense fiscal pressure. They have a large structural deficit they're trying to deal with, but also in part because they haven't been very successful. So that the proposal is to eliminate funding and simply allow TANF recipients to go to the unemployment offices, to the workforce offices, and access the same services that are available to other unemployed individuals. And so I got two questions, and the order is important. One, is this going to cost us any money? Will we lose some federal funding if we do this? That was the first question I was asked. The second question is, would this work? Is this going to reduce the services that are available to help our TANF recipients move into work? And we don't actually have any research on this, right? We have there's some research evidence that we can draw on. We can talk a little bit about how our experience with workforce services is they haven't been, unless there's a special effort, they haven't been very successful in engaging recipients in the individuals who have the challenges our welfare populations have. They're much better at working with other unemployed folks that are unemployed short-term, that have some job experience, that have some skills to come in and find them other work. So we can get a little bit, but we have to have the answer by Wednesday when the legislative session ends and they have to adopt the budget. So I expect my phone to buzz. It won't ring. Buzz while I'm sitting here. I promise I won't answer it. I'm asking for, well, what's the answer? So those are the kinds of challenges in a not typical but not completely atypical example of the kinds of ways we have to ask questions. So I want to turn to Don and then Julie to ask their questions and start this discussion in the efforts to try to answer them. Don?
Okay. Well, I love the ground rules of asking my question and they're being required to answer. So this is a lot of fun. Let me say, just if I may, before I ask a question, Jack, that it strikes me as we've talked about this session, I was reminded that in the early to mid 90s, in the kind of the run-up to the 96 legislation, there were a number of different activities around the country or forums and where there was a concerted effort to bring together policymakers and researchers and to have that kind of dialogue that I think really informed the debate and the discussion leading to welfare reform. And a lot of that was around some of the waiver demonstration programs of the late 80s and early 90s and all of that. It was a very good conversation, so I think it's great to have this conversation again. And I think also that continuing that conversation has really been one of the benefits of this whole series of evaluation conferences that ACF and OPRE has continued to sponsor over the years, and I just want to commend Naomi and for continuing in this tradition, because I think it's very important for us to continue having the dialogue and continue to learn from research and ask the hard questions, which I will now do. As Jack mentioned, I wear two hats these days. I'm Deputy Secretary of the Department of Children and Families and also serve as Special Advisor to the Governor for implementation of the Recovery Act. So I'll ask a question that crosses those two worlds. Of course, as everybody in this room knows, the Recovery Act created a TANF emergency fund that provides certain opportunities for 80% reimbursement for states that have increases in basic assistance, short-term non-recurrent payments, or subsidized employment. And some of that is going to happen naturally, for example, in basic assistance with caseload. Caseloads will go up or not, but probably, at least in my state, going up. And that emergency fund will be a benefit. But if a state really wants to take advantage of the opportunity to try to tap some additional resources related particularly to short-term non-recurrent benefits or subsidized employment, or look at the structure of its basic assistance program, are there research findings that would suggest strategies that would not only take advantage of resources but also be more effective in terms of spurring recovery and helping low-income families move to a better circumstance?
That's a nice, easy question. You know, it's a little interesting, this format, because one of the things I pride myself in as a researcher when I work with policy officials that have questions is actually spending most of my time asking questions rather than necessarily answering questions. But having said that, I think one of the exciting opportunities that states might face right now in this current environment is to look at using some of this money for transitional employment. And I'm not sure that, I know that there's lots of issues around mounting successful transitional employment programs and lots of challenges there. But as I sat and listened to Dan Bloom's presentation yesterday on the findings about transitional employment, there seemed to be two things that stood out to me. One, if your goal is short-term employment, if your goal is helping people get into the labor market, the results of the experiments on transitional employment suggest that it is quite successful at doing that, both for an array of populations, including TANF recipients. So that's the good news for short-term outcomes and impacts for using those resources. The bad news on the transitional employment side was that the long-term effects fade. And we don't know why they fade, but Dan suggested, and I would tend to agree, that there are a couple promising, this would be an opportunity to do some experimentation. As a researcher, we love opportunities for evaluation that could also coincide with opportunities for states to do good things for people. And so it would be really exciting to do some planned variation around the conceptual framework when one might look at extending the period of subsidized employment to see if that makes a difference in longer-term outcomes, and then perhaps more intriguingly, combining subsidized employment with some kind of targeted skills training, because most of these programs have not included targeted skills training to date. And if our goal is really long-term, helping a short-term need, but really helping folks be successful in the labor force in the long term, it would be a chance to test some of those strategies and almost a form of apprenticeship to say, let's see if we can really try to do some strategies where we get folks into areas that offer long-term promise, give them a boost in the short term, and see if it works, and evaluate it rigorously and learn from it.
I think a couple of issues. One is that I'm always looking for the, I'm an optimist by nature, so I'm always looking for optimistic opportunities. And I think that certainly the recession is devastating, and the effect on states, on state governments, as well as families and individuals is very severe. But for those of us who've been looking at employment and welfare programs for as many years as we have, over 30 years, through many rounds of welfare reform, it seems that a real opportunity exists, not only for looking at subsidized employment, and I think it should go beyond sort of what has come to be called transitional jobs, but also invest in training at this point, because politically there is more support during periods of high unemployment for investment in training. We see that in the Recovery Act as well. So this is a good time to invest in training politically, and it's also a good time to identify individuals who would be willing to forego other employment to participate in training. We also need to complement that with subsidies, and so they have some income coming in while they're in training. Otherwise, it's only going to be the middle income and higher income people who can afford to participate in the training, even if the training is paid for. So I think there is an opportunity to invest in training. I would echo what Mike said, and also combine the subsidized employment with skills training. I know I've mentioned to a few people, and it's not because of Bob Plurman, that I think that the registered apprenticeship model is really important. And it's important because it identifies sort of the standards and skills that industries have identified, and also it has a portability, which during a period of recession, to have the ability to take whatever skills you develop and have it recognized in other states is also an important opportunity. So during a recession also, I would invest in learning more about both strategies to meet the immediate short-term challenges, which is economic hardship, but also think about improving the capacity of the systems long-term in terms of sustaining some of the innovative programming that can exist. Now, we have a lot of research on the effect of subsidized employment. We can talk more about that, but I think it's also important, maybe for the first question, I'll just stop at this point, is that there are different kinds of research. And here, this conference has been terrific, and we've heard especially a lot about results from random assignment experiments, which is wonderful, and we have an explosion of findings coming out on various approaches. There are also the results from non-experimental analysis of outcomes and impacts that is also important. We've heard some of that. But what we've heard less about at this conference, which also is very important, is program outcomes and performance analysis of programs. And then the final category is implementation analysis, which often helps us with some of the immediate kinds of questions that Jack was talking about. We could talk about Jack's question also. But the combination of both performance analysis and implementation analysis should be coupled with the results from the experimental and non-experimental impact analysis.
Julie?
I like this setup, but sorry about that, everybody out there. So excuse my side or back, but I want to pick up where Demetra stopped. So I have some questions that I'll get to about specific kinds of research that we would find useful, but I want to talk about this broader categories of research. One of the, obviously when we talk about helping inform policymakers, frequently we're talking about policymakers at the federal and state level, right? And yet the way that a lot of the evidence is often frustratingly left to sound bites.
Yes.
And digging in to actually take advantage of that evidence on the ground is a huge challenge. And I think researchers have a role and could potentially redirect or include more levels of policy doers, not just policy makers. So I want to pick up on Demetra's. What are ideas that you have for how those of us who are really trying to work from evidence-based policymaking can take it a step further to improve the understanding of what that evidence tells us, and how can we get that all the way to the front line of service delivery?
You want to go first this time?
Well, I think, let's see. I think one of the issues in that is having an understanding, not only the policymakers, but the researchers, and to different degrees. Some of us do this better than others, and some policy people and program administrators do it better, but to really understand what's happening operationally at the local level. One of the errors, I think, in research and in program management or policy making is the inclination to gather up a few program administrators and talk about some of these operational issues, and think that by talking to managers and supervisors, you know what's going on at the ground level. And those of us who do implementation research know that's not the case. So that if you want to engage sort of the field, it means going below the administrative level to find out what's really happening operationally. There are some states, and most states have some mechanism to allow the line staff to participate in some of those program discussions. But it also has to go beyond the line staff to other service providers, service delivery agents, the nonprofit service delivery system as well, and not just within the public human service agencies. One of the issues that I think is very important now, and I've learned this from talking to Don over the years, is that, and everybody in this room knows this, that the TANF cash for adults is a really small piece of the social safety net that we need to consider, because it means that if you are just focusing on what's happening within that small piece of the overall safety net, we're missing opportunities to help the low-income families and low-income people, which means engaging across systems and not just within the TANF agency. So I would say we need to engage the line staff within the human services agencies, but also within the partnering organizations, whether they're partnering or not. And in some places they don't really partner, but maybe they should. So that's one response.
Yeah, Julie, I think your question's a really interesting question. It's really hard, to be honest with you, to find a way to get that kind of connection to happen on the line, because it really takes interaction. I mean, at least in my experience, you know, the adult learning modality is really one of people come into any situation with a set of experiences that are very real for them, and then there's a set of information you're asking them to integrate into those experiences, so they might see things a different way, and then there's a learning process that takes place, and it's an interactive both ways. The researchers learn and implementers learn. And to create forums for that is something that's a really challenging thing to do. I mean, the experience where I've come across that in more practice has been when we've been trying to design demonstrations on the ground. and will go into a community that has an interest in being involved in a new way of doing something, and spend a lot of time actually sitting and talking to line workers and managers on the ground to understand their experience and to ask them for ideas that they have about how they can do things better. And then in that context to say, well, we've learned from experience, we've learned from research that X, Y, and Z can make a difference, and then have a discussion around that, and they have a chance to incorporate that into their own experience. But to do that on scale, I think, is a real challenging thing, because then you've got to find a way to get that, to make that happen. It would be intriguing to see if one can do that, taking advantage of webcasts and some of the new technology, to not have it necessarily have to be a live face-to-face experience. But I don't know a substitute for actually, if you really want line workers and folks on the line, you can bring them to conferences. You can have, and I know Colorado, for instance, we've been doing a project with Colorado when I was with the Lewin Group for some time now, where they have regular meetings every year where they bring lots of folks from across the state and line workers together to talk about their experiences, to engage in workshops. They bring researchers in to share experience. I mean, I think that's one method. But I think we need to find more creative methods to do that, frankly.
Don, second question?
Well, before I do second question, can I ask a follow-up maybe on the first?
Of course.
Or that could be my second question. Well, just first a comment just on that last point, because I think one of the challenges in a lot of places also is when we talk about the frontline worker, for example, in our system, where we're heavily integrated with the workforce system, the frontline worker, and I look and see my colleague Grant Collins, who's been involved in some of this work in our state also, is the frontline worker is likely to be a provider, subcontractor to a contractor to an agency.
Right.
And so it's not really, I think people that are used to administering agencies where the frontline work is done by public employees have to think also about where you're dealing not only with in contract situations, but subcontracting in various providers in different service systems. It just adds a dimension to that whole activity, although it's still, the point is the same, that important to have that perspective. I wanted to follow up on Demetra's comment about apprenticeship, because I know I've been involved in some discussions recently with some folks in organized labor related to the Davis-Bacon provisions of the Recovery Act, and that there are some additional advantages of apprenticeship from an employer perspective there, and wondered about research findings in the area of apprenticeship as a pathway for former TANF recipients specifically, or more generally for low-income individuals. Is there anything in that area that would be instructive?
There isn't as much as there should be, and we don't have a lot of real hard experimental analysis on that. One of the issues, I think that the registered apprenticeship option is very valuable because it is industry designed, usually union involved, with a mechanism that is very detailed about the skills, about the curriculum. It's also long-term training, which was another question, so that if you are in an apprenticeship program, for example, to be an electrician, you have many hundreds of hours or whatever it is. And there are several hundred, I don't know if anyone is here from the Labor Department, but there are several hundred occupations for which there are clear curricula for registered apprenticeship opportunities. The federal government doesn't pay for any of that training. It serves as the vehicle, the clearinghouse, and the certification avenue from the Labor Department. The difficulty, and this is a huge difficulty, especially in a recession, is that because it is industry focused and industry driven, the employers have a big say on, and the unions, of who is getting into those programs and what the outcome is in terms of subsequent employment. And just like in the labor market as a whole, women and low-skilled people are at the bottom of the line. during a recession, and we haven't talked much about this at this conference, but we know from all of the economic and labor market analysis that especially during a recession, it is very difficult for the low skill because of the competition looking for the few jobs that are out there. Welfare recipients, low-skilled workers, youth are going, women in some cases are going to go to the bottom of the line. That's true also in apprenticeship, even not in a recession. So it's much more difficult to find good apprenticeship programs that have established options for TANF recipients or low-income workers in general. There are many of them. And for example, one that I'm looking at right now is the Chicago Women in the Trades, which is a program in Chicago, and there are many construction trade pre-apprenticeship programs. They have pathways from pre-apprenticeship into apprenticeship, usually with some union involvement and possibly some link to community colleges that supplement some of the remedial or developmental work that needs to be done. So there are a number of non-traditional occupations where we know that the wage progression is likely to be high. We have a hard time getting women interested in those jobs, and we have a hard time getting businesses willing to hire, and there are sort of entry barriers that require some special interventions. There are a lot of models, and I think it is an opportunity. It's not for a huge proportion of the TANF population, but for those women who are interested in one of the apprenticeshable occupations, it is worth some extra support and extra development to get them into those high wage progression occupations.
Yeah, I'm not familiar with any rigorous research that I could bring to the table on this. Hopefully maybe there's someone else in the audience that is. I guess I'm intrigued by the idea of what I characterize as apprenticeship-like programs, that it may be very difficult for these structured apprenticeship programs that exist now, but if you if you were to combine it with subsidized employment and skills training and create a ladder that had some duration, then there might be a way to begin to structure some things that parallel an apprenticeship program but may not have some of the established requirements and reliance on industry that the current programs have.
And apprenticeship programs all pay people while they're in the apprenticeship, and then once they complete, the salaries go up to the scale for that occupation.
I want to turn to one of the questions on caseload reduction research. Even though caseloads went from, say, 60,000 to lower than 6,000 at one point in Wisconsin, and trying to understand what that represents is important. We had a lever study maybe 10 years ago, but we're concerned that as the economy changes, we're still not seeing perhaps the same level of people coming to those offices. And so we're trying to understand. In our department, we have terrific resources with researchers, some of whom are here. But I wonder if other states have done similar efforts and if there are methodologies that we should take into account. In Wisconsin, what we've been looking at is we took the food stamp cases where it looked like they could be a W-2 family. And then we focused just on those that had no reported earnings or income, which is very worrying, of course. And then we started to peel back from there. And we incorporated a survey and then some follow-up phone calls with those who were interested. And we're getting good information from that, but I wonder if there are other states that are doing these things and if there are suggestions you can make for us.
Julie, just to ask a follow-up question to your question, I mean, is the goal of your inquiry to try to understand? I mean, because you can kind of figure out, is there a population that's eligible for TANF that's not taking advantage of TANF? That's kind of one question. Who is that possible population? And kind of the pathway of looking at the food stamp caseload is a really good way to do that, it seems to me, as a starting point using administrative data. But then the next question is, if they're eligible for TANF, why aren't they participating in TANF? And so are you trying to understand both kind of the nature of the population itself, but also try to understand what's behind the non-participation?
Yes. I mean, follow up on that, we have, I have recently come to state government, recently meaning within the year. And one of the things that the welfare reform has done over the last 12 or 13 years is convince state lawmakers that they've succeeded, finished, done with welfare reform. Right. And that's largely because of caseload reduction numbers. Mm-hmm. And the fact that the federal block grant hasn't changed, and even though we're spending a lot of money on things that are absolutely important and desirable, like child care, but the amount of money, you know, it's just become this vicious cycle where it appears that people don't need or want the program, and so you have no, in states where you have so many other demands for that money, there's no reason to say we can do this. And now politically it's become a liability for any governor or legislator to say, gee, maybe our caseload should be higher. Mm-hmm. So I'm, first of all, before I even try to deal with the political minefield out there, the first thing I need is to be able to give my secretary and others in decision making some idea if we understand who might be out there who want and need TANF as opposed to maybe need it but don't want it or don't need it.
Right. Go ahead.
I mean, I think then it seems to me there needs to be a way to reach out to that population beyond what you can get from administrative data to really probe what's happening with them, and whether that's through some kind of a survey to understand more of their experiences and where they're getting
You're kind
support.
of asking questions again, Mike.
I know
You're supposed
I
to
am.
answer them.
Well, I'm doing the best I can, Jack. As I said, researchers ask questions.
Well,
Well, do you know of states that are doing
I
anything?
do not know of states that are doing that.
But what,
I think-
let me try to put the question a little harder. I work for legislators who sometimes you would get a question like, "Are we serving our families? Is our safety
Right,
net
that's
working?"
That's the issue.
If in this economy where we've got huge increases in food stamps, large increases in unemployment, small or declines in many cases in TANF, is the TANF part of the safety net working?
Well, see, this is what I was going to say is I'm certainly not as politically astute as the three of you. But it seems to me that
New in town, are you?
It seems to me that the arena has to change, because it really is about a safety net for families and maybe workers, whichever one has the most politically viable connotation in your particular jurisdiction. But I think it needs to be, certainly outreach can be helpful, and I don't know if Swati is still in here, but in New York City, one of the issues, and Bert Barno and I just finished an evaluation for Swati looking at outreach to the food stamp population by having neighborhood centers that with community-based partners doing the outreach to the eligible population to bring in more. So the fact that the food stamp caseload has gone way up doesn't mean that all people who are eligible for food stamps are getting food stamps either. And it looks like from our analysis that the population groups that have been reached, one is working families, so whether they are working or are usually working or working low wage, those are people who might not on their own come in to seek benefits and services. And the other group was households with mixed immigrant, non-immigrant members in the household. So that by having, the long answer is, by having community-based organizations in the neighborhoods who have credibility with the population, there may be more opportunity to reach those who are eligible. But I think a bigger issue is what Jack is talking about, is that we need to sort of restructure the dialogue around the safety net, and it is more than just those who are eligible for TANF, even if you go up to the 200% of poverty, but by looking at all of the program resources together, are we doing anything to move families out of poverty to make sure that people who are working are above poverty. And so switching the dialogue from sort of a welfare dialogue to an income or an anti-poverty dialogue, I think, is the right framework for what TANF now is, which is a very small piece of the total package.
But I think you raise an interesting question, and Jack does too, which is then what is the role of TANF in that safety net? And you've got a series of, you've got large numbers of families in the state that look like they're TANF eligible, but they're not participating in TANF. And it seems to me there are two parts to that question then. From a policy perspective, what do you want the role of TANF to be in the safety net of the state? And that's really a policy question. That's not a research question. The other side of the question is you've got folks that look like they're eligible to participate, but they're not. Why aren't they participating? And it seems to me the only way you can find out why they're not participating is to find a way to ask them why they're not participating, to find a way to reach out to them, whether it's through surveys, whether it's through focus groups, whether it's through community-based organizations that work with and represent those families, to understand what is how do they see, what does the TANF program mean to them today? When they hear the TANF program or the W-2 program, what does that say to them? What are the messages and what are their perceptions of that program? And what do they see that program has to give them? And then, why aren't they accessing it? And it may be they're not accessing it because as they look at what that program is, it's not, they don't see it as a part of the safety net anymore. They see it as serving a different function.
And one way to get at that flip side could be identifying why people who are on TANF, coming on to TANF, why they're coming on. And I don't know, is Linda Martin still here from South Carolina? So South Carolina has figured out that a lot of the people are on TANF because they want childcare when they leave. So it's an easier gateway to childcare. It's not the small little piddly amount of benefit, cash benefit that they're getting that's bringing them in. It's something else. And it used to be that it was, maybe food stamps and Medicaid, but they don't need the TANF gateway to get that benefit. In some states like South Carolina, they still need it for child care. So it's hard to find sort of the eligible non-participating population, but you've already got the eligible participating population, and maybe asking them in as discreet a way as possible why they're participating might help answer some of the question.
So I want to ask one more quick response question, if you will, quick response in a couple ways I'll talk about. But I also want to give Demetra and Mike after that so you can start thinking about kind of the other side of it, kind of like what researchers would like to tell policymakers about how they could better use research. Okay. And maybe if you can quickly respond to that you can ask questions of them. But the quick response question, it's based on Don's first question, which is the TANF Emergency Fund provided for additional federal support for basic assistance and subsidized work and short-term benefits, so that the federal government will reimburse states for 80% of the increase in their costs for short-term benefits, which raises questions about, is there and we talked about this a lot kind of in the beginning of TANF, and some states implemented it a bit, and some states in a much weaker way, but is it worth thinking about a very aggressive diversion strategy? Where I've talked to a couple of states about the idea that not in their TANF offices, but they're in unemployment insurance offices. If an individual comes in, if a parent comes in and doesn't have work and doesn't have household income above kind of 200% of the level of poverty, the idea of getting services around transportation, what do you have adequate transportation? What do you need to get that? Whether it's a car repair or a car or license and registration fees, whatever the cost is, whatever they need, that's the standard. Or housing issues, or work expense issues, or training issues, where they could use TANF funds, short-term benefit funds, to provide that parent with whatever they need to substantially increase the chance they get employed, whether it's they have a job offer or it simply looks like it would help a lot. What do we know about this kind of aggressive diversion approach from research?
I don't think we know very much, to be honest with you. I mean, I think it's a great idea as a way of getting services and support to families, what you're suggesting. But in terms of what we know from research, we've done implementation. There's been implementation work looking at diversion programs. But I don't think we know much about it from an impact perspective.
Yeah, I mean, this has been allowable under TANF all along, and there are some places that do more of it when there was excess resources or above the cash amount. You
Never
saw more
excess
of it.
resources,
Whatever.
available resources.
I was going to say surplus. I figured excess resources was better than surplus. But it is certainly, you know, common, and you see that. It was more common when there wasn't as much demand on the caseload. So in places where the caseloads are going up, there is less room for them to justify those kinds of expenditures, ironically, just at the time when it's needed more. And, you know, I think having the opportunity to apply for those support benefits in some place other than the regular TANF agency probably makes sense also. And I think that's an implementation issue. I think the other issue around sort of the short-term, non-recurrent short-term assistance during the recovery time frame is also interesting, because if it's framed properly, it could be an important vehicle to rebrand the human service agencies in some way, and to maybe do what I think needs to be done in the long term, which is sort of get out of the small TANF box and get into a broader mission of helping working families. And that would be a way to do it. The problem is that you have to make sure you do it in a way that doesn't, at the end of the recession, not adjust properly to help those who are in more need, because the non-recurring short-term assistance is likely to go to those at higher ability levels or higher income levels. And again, my concern during a recession always is that the ones that are the most disadvantaged, the lowest skilled, with the least opportunities, are the ones that get left get left behind a little bit, and you have to just have policies to make sure that doesn't happen.
Did you want, so your answers sound a lot like what I've had to say, which is it sounds good, it might work, but we don't know.
We don't know.
We don't
We don't have research to
I mean,
speak to.
That's pretty much.
We have program models, but we don't have any experimental evidence.
So as researchers, what do you have to say to policymakers to try to increase this bridge? What advice would you give policymakers about accessing research and using it?
Actually, I think policymakers have gotten so much better and more sophisticated over the years, frankly, in using research. There's so much more dialogue than there used to be. There's so much more understanding of the benefits of research and a range of research. So I guess my real advice to policymakers is to engage and to find researchers that you can engage with on a regular basis, and to think of research very broadly. Not just research from the point of view of experimental studies, which I think are incredibly important. I'm a very strong fan of experimental research. But to think of research from the perspective of you've got lots of data in your systems, and I know and really how to take advantage of the data you have in your administrative systems to learn about both the people you're serving and the services they're receiving, and how researchers can be a resource to you to understand that better and to understand the implementation of your programs better, I think is something that can happen more, and to see researchers as an additional resource for you. I would love to see policymakers look for ways to do what I call small-scale experimental studies, where you've got a question you're trying to answer in your operations that's a process question. You know, is it better to have people move into the system through this door or that door? Or does it make a difference if we've got an earnings disregard of this size or that size? We really don't know. Or we want to run a diversion program, but we'd actually like to know if it works or not. And it's not that hard anymore to set up experimental structures to do that. And we've got a lot of sophistication now to put devices in place, web-based devices that online staff can use to do the random assignment, to use your basic data collection already to give us baseline data on folks that are moving into these interventions, and to use administrative data to answer simple questions as to how these approaches are working. You may not be able to get to long-term and underlying questions that we'd all like to know, but you can sure find out whether these different processes lead to different participation patterns, lead to different outcomes in terms of employment and earnings based on your administrative data. And you can really create a learning laboratory then within your environments that can really build even a stronger base of understanding about what works.
Mm-hmm. I guess I would also, I agree with what Mike said, and I would also hope that in partnership with the research community that especially state administrators could do more to help access and use administrative data for research purposes. And so, for example, along with the improved technology and availability of, a tremendous amount of data on individuals and on economic issues and the earnings data from the UI system, comes an understandable concern about privacy and confidentiality. But what has happened over the past 10 years is that it's much more difficult for researchers to gain access to some of the administrative data that would allow the ongoing analysis to answer some of the big questions. So I think that having more support, and certainly HHS is, and the Department of Labor are doing much in this area to make sure that there is access for research purposes. But I think the state policymakers can help with that as well. So that would include not only accessing the state unemployment insurance quarterly earnings data, which in many states, many of you right in here, can't even access the earnings data in your own state for analysis that you want done of your own program. Not Florida. Florida, you can do it. And in Wisconsin, you can do it. But in a lot of states, it's not even possible for a state human service agency to engage a researcher to analyze data in their own state, because it's hard for them to, because of confidentiality laws, to be able to access the data. So I think having maybe a task force of state officials, not only from the human services side, but from the employment agencies, could help to open up some of the access to that, making sure that we have confidential data. I think another way to do that, and again, these are two exceptional states in this regard, is to infuse the analysis for both evaluation and research purposes and program management purposes. And here again, I want to just mention the importance of sort of data for management purposes, for planning, for performance management, and integrating that into an ongoing institutionalized acceptance and understanding of the research. That sometimes means having on staff someone who can do the kind of statistical analysis that is important, but there's certainly most, and I don't know about in Florida, but I know in Wisconsin the university system has expert, and in many states the universities provide that capacity. So I don't think you always have to look to outsiders to do some of the research and evaluation. There are some kinds of studies, particularly if you're doing sort of a formal evaluation, it's better to have the evaluator detached from the program. If you're doing implementation and process analysis, it's better to have an outside neutral researcher doing that, and not big shots from the state going into the local offices to try to find out what's going on. But by infusing sort of an understanding and acceptance and a capability in-house to raise the visibility of research within the organization, it helps then for outsiders. It makes it easier for outsiders who come in later to also participate in the evaluation, so you don't have to recreate databases all the time. So for example, in some states, I think Florida is like this, Washington State have ongoing longitudinal databases. Wisconsin has this as well. Ongoing longitudinal databases that have been linking across programs for 20 years or 30 years. And sometimes you've got one person somewhere who's linking those data, And that person may not want a lot of attention on what that person is doing because some governor might come along and say, well, do we really need that, that database to be maintained? So by encouraging and making sure you keep that in the budget, I think it makes it easier for those of us who are not part of your system to come in and supplement the analysis that's being done.
So I want to broaden the discussion, invite, even though the setting is awkward, if there's people who have comments, I will also allow, if people want to ask Mike and Demetra a question that they have to answer, I'll enforce that with others as well.
Or Julie and Dawn.
Or Julie and Dawn. So I want to invite that broadening, but I also would like Julie and Dawn to talk about, both Mike and Demetra talked about in different ways kind of building in research using at least capacity within agencies and sometimes research producing. So I think it'd be worth Don and Julie doing that, and I'll keep an eye out if we can bridge the gulf between the lighted podium and the broad room. I think that'd be great.
Well, I think, and to just kind of build on what Demetra said, I think there's a real opportunity, and I don't think we've taken advantage of the potential there. Because I think one of the things that I've found, and as Demetra said, we do have a fair amount of administrative data. And to Julie's earlier question, and I mean, we, for example, at the 10th, right after the 10th anniversary of TANF, we, did a study, was just curious, what happened to the people who were with us on day one, and what ultimately happened? Were they still with us? Were they not? Were they getting food stamps, Medicaid? And we were able to go into not only food stamps and Medicaid, which we have easy access to, but to see how many of them went to community college, how many of them subsequently went to university, different vocational education paths, how many of them went to prison, what their UC earnings and employment information was. And we have, I mean, it's not that you can't flip a switch, but it's not that difficult to get to that. But the people, the human resources we have to ask those questions and get those answers are very limited, and those people have many just operational questions and federal reporting questions that they have to deal with. So I think one of the things that states could really benefit from the research community is a better understanding and a broader toolkit of the analytic tools. Because, I mean, there was a day a long time ago where we had more questions than we had data. When it comes to administrative data, we have just much more data than we have time to analyze. Yeah. And I think the analytic tools that the research community can bring to state administrators and help us more efficiently mine that data would be a tremendous benefit, because a lot of it's there that we just don't have really much time to look at and reflect on because of just resources. The day-to-day issues, particularly these days. I think the other thing that I think is the most interesting part, and particularly as we think towards the future and kind of what the future role of TANF should be, is the questions that occur at the connecting points of various programs. The connecting point between TANF and SSI with people who are have disabilities or incapacities. The connecting point, you mentioned child care, and is it, I don't need TANF, I need a pathway to child care. Right. A fair question about, what's kind of the pros and cons if I were looking at a broader policy question about a higher earnings disregard versus why not just take that money away from TANF and increase the EITC. Right. And tremendous intersection questions with the role of TANF and now unemployment compensation.
And child support.
And child support, yeah. So those connecting point questions, I think, are the ones that are are some really interesting ones. And thinking in terms of if we're going to have, and maybe we will and maybe we won't, a really interesting discussion and debate in preparation for the next TANF reauthorization, kind of which of those questions can we bring the most research evidence to point to directions, to me, is something at least worthy of trying to figure out.
I want to ask a question instead of say something. Can you help us figure out how to measure total household income in anything close to real time, and how you make decisions about what to include in that, if our goal is to make sure that operationally people are better off as a result of being in the program?
It's the real-time part that throws you off.
Yeah, that's tough.
I mean, I think that in Wisconsin, the university does a really good job at looking at different measures of household income, including different components to the income. But the real time, you mean like instantaneous, like day to day or week to week? What do you mean by real time?
How about defining it as not 9 months later?
Right. Within a 3 to 4 month time period, would we be able to look back and say?
Well, I know that the what's the data system that people use, the work pays, what's it called, the talks?
Talks.
I mean, that's the closest. I don't know what the cost is, and it's another vendor that's doing it, but a lot of states are doing that. I'm not as familiar with it, but I know a lot of states use that talks system, which is presumably more real time than you can get from the earnings data system.
I mean, yeah, I guess the question is...
How good that is and how efficient it is in terms
Well,
of the
what
cost,
would you
I don't know.
include? What measures do you think should be included if we're...
And when you're looking at family income, you want to look at cash, or you want cash as
and
well as
non-cash.
non-cash?
Right.
You want both,
I guess
right?
I'm asking advice from you on...
Well, just getting the cash, I mean, just getting the payroll information, if you go through the regular employer reporting system, there is going to be a lag. This talks system, they say it's more current than that, but I've not, others here, a lot of people in here are familiar with that, so maybe someone here can...
To me, the
talk about
challenge, and you know, it's not only getting the information, but filtering out the clutter. Because, you know, if you want to get information about a person or 2 people or 5 people, that's pretty easy to do. Getting information and filtering out the false positives and the stuff that is extraneous or obsolete or irrelevant on 1.8 million people is the challenge.
Yeah, and costly if you...
Yeah, because, you know, you send out the queries electronically and you get it back.
Right.
And then somebody has to look at that and somebody has to decide is that relevant now or is it irrelevant? Right. Or is it a person of a similar name and the social, you know, that...
The validity.
Right, just kind of getting the clutter out of it. When you do it at retail, you know, at scale, is at least been the challenge for us, because we get a lot of information about people, an incredible amount of information that's available of varying degrees of reliability or usefulness, and getting the best stuff and filtering out. In fact, if somebody's got a good tool that does that automatically, that'd be something we'd buy.
Yeah, I mean, I guess the question is, to what extent does the perfect have to be the enemy of the good enough? And so, you know, it seems like if I was trying to tackle this question, I would define exactly what I would want to collect, get the latest wage information I could get, you know, if there information on child support payments, information on direct cash benefit payments, maybe you include information on food stamp benefits, maybe you include information on child care payments. So just pick a set. And then look at your administrative data sources for each of them. And look at your administrative data sources for each of those things, and maybe take a sample, you know, take a smaller sample to start with. Pick a sample of 100 or 500 or whatever is a workable sample, and do a creative matched data set around that, and then begin to try to, and then work with it, you know, and then you'll find where your problems are, and you can then create automated ways of weeding out known problems.
So how do we, let me just ask specifically about the EITC, which most people collect on an annual basis, which is a much larger investment on the part of the federal government than TANF cash assistance at this point. What's the latest on how states should think about counting that or not counting that?
Well, counting it for what purpose? Knowing whether they're receiving it or not? I mean, it's income.
No, I'm sorry, counting it for, in something other than an
Success.
annual basis looking back. To be able to tell if families,
But a lot of people don't
Don't
get it
get
on
it.
a
I mean, they get
regular
it on an
basis.
annual basis.
It's not like New Hope yet.
Yeah.
So they don't necessarily get it on an ongoing basis.
So if we can go to the, a brave audience member who's trying to broaden the discussion, so.
I'm Richard Spiegelman, Child Economic Policies in California. Just to complicate things, I feel like in this era of foreclosure, the question of who's in what household is important.
Right, right.
How you value or account for those expenses, rent-related expenses or in kind or whatever, just to make your life harder. I feel
Yeah.
like as a researcher, we often have to just sort of close our eyes at some point and say, okay, that's as good as we're going to get. I don't think it's all that good a lot of the time.
Yeah, that's right.
I won't argue with that.
I mean, one of the challenges that we have in research often is using the household roster just to create what the units are. And so researchers spend a lot of time doing that, and it's much more difficult to do it on a real time. I think the real challenge of Julie's question was the real time issue and not the composition of the income. But you're absolutely right, the defining the household is also complicated.
Although I think also, as Richard's question suggests, I mean, contrast the picture you get of the situation if you use the best, most current available administrative data versus the picture you would get if a good ethnographic researcher went out and spent time with the family.
Right,
Right.
right.
So I want to change things up a little bit, and the researcher has been put on the spot, and I want to put the policymakers on the spot, and particularly in both Julie and Don and most people in their kinds of positions have a lot of time to focus on these kinds of questions. Not enough time. I'm not misunderstanding that. But a lot of time to focus it. But a lot of the key decision makers are made by governors, folks, or legislators who don't have the understanding or the time. So that when I talk to legislators, I always think of I have at most 5 minutes to engage them and to kind of get them kind of involved, and maybe I can have more time to that. 5 minutes on these issues is, I don't know how many times Mike and Demetra actually managed to answer any of the questions in 5 minutes. So talk about how you can successfully deal with policymakers at that level and bring research to bear on the kind of decisions they have to make. And kind of where there might be successes and where there might be challenges, because my guess is your experience has been a lot like mine, where sometimes you can succeed in bringing research so that it informs their decision, and sometimes it doesn't work, and other things inform the decision. So,
It's an interesting question. I think a couple of things. First of all, part of the challenge is in the current environment, particularly with, say, working with legislators, as you do all the time. I mean, our state has 8-year term limits, so that the group of people who are the key decision makers are constantly being refreshed. When I left Florida in 2001 and came to Washington, then went back to Florida in 2005 and went to the legislative session and testified before the first committee in the House of Representatives, I looked up at the committee and I said, who are these people? I mean, and last session I was giving a presentation, and part of the presentation was talking about the TANF caseload reduction credit and the maintenance of effort requirement, and I had a slide that used the term MO, and I thought, no, that's a mistake. So and I was trying to be very careful, maintenance of effort, and gave the 30-second, description of what maintenance of effort is, and all of that, and a member was really working hard to get it, and says, okay, I think I got the maintenance of effort thing, but I do have a question. What is this TANF thing? And you go, well, dumb old me. I should have seen that one coming. So there's a constant re-education kind of process that you have to go through. To me, a couple of important things are, first of all, I mean, it's like the old thing of, generals always fight or prepare for the last war. I think part of the current reality is very different now, just given the economy, than what's been in place in the past. And I think it starts with us trying to understand as best we can what the situation is and what some of the directions might be. And then the other is, I think that 5-minute conversation with key legislators cannot be a one-time 5-minute conversation. Right. It has to be a series of conversations that is listening as well as informing. I mean, I'm impressed that a lot of members work really hard to get it, and they've got so many things hitting them from so many different directions that I think we can always do a better job of helping to make it more accessible, but I think we make a mistake sometimes if we try to oversimplify it, because I think they are capable of getting it and making good decisions, but it can't be a one-time thing. It has to be an ongoing conversation, and you have to really build credibility, because from their perspective, the most carefully crafted, rigorous research and the newspaper story by some nut all looks the same.
Right.
And so it really, you've really got to have them at least have a sense that you're at least not some random perspective that they might hear and somebody they at least ought to spend 5 minutes with.
Right. I'm learning about how to do this, but I'm trying to approach it from the perspective of my decades as an organizer, actually. So one of the first things that I think is important is that I need to understand what problems they're trying to solve so that I can fit what we're working on and are trying to do into that. So for example, in Wisconsin, as in every other state, how can we actually take advantage of the ARA resources in ways that fit within the framework of our state budget and take us further in serving people. But there's a lot there. It is difficult, and again, we're working through people, as you said, and our efforts have to be pretty continual, I think, just trying to find out what it is that they care about, what it is that they're concerned about, and trying to make sure that we get on their radar screen. Budget process is obviously one important way that we do that. We also have made use of people like Jack and researchers. Sometimes the people that, sometimes you're inside, I'm not being very articulate, you need somebody from the outside to say what people on the inside are saying, and then people can hear it. Right. And I get that, and I honor it, and we had a great little success story with Jack coming and presenting information to some people from our governor's office who had been very wary of what we were telling them. And then he was able to say, no, that's true, and other states have done it, and it was great. So it was more than 5 minutes, though.
Can I give a 1-minute response?
Yes.
1-minute response to that, I think, is that researchers have gotten better, the good researchers, have gotten better at being able to distill a body of products that come out of a study that may be thousands of pages long down to not only executive summary, but sometimes 1 page. I think the challenge is to avoid what Don was talking about, is that not all researchers are good researchers, and that there needs to be some discrimination between sort of a high-quality, short 1-pager soundbite versus a less accurate summary. And I think that would be improved by increasing the institutional capacity in-house about analysis and research to hold the researchers to a higher standard.
So in the absence of further questions, I'd be happy to.
There's something.
Good morning. Larry Goolsby from APHSA, and very good panel, and I especially was glad to hear Don Winstead speak, I'm sure on behalf of all the state administrators, when he mentioned the roadblocks and the challenges that we have in the time and ability and funding to do what we'd all like to do with administrative data. And I'm thinking back to welfare reform in the mid-'90s when it came out, and we were faced with regulations from ACF that, as I recall, had something like 170 different new data elements that ACF was wanting us to report on. Now, we had a little difficulty with that, and I think we ended up with a lesser number of data elements being required than the original 100 and something. But, you know, the issue we had at that time was the massive impact on state computer systems and time and ability just to gather the information. Now, I understand that TANF caseloads, are a very rich source of information, good information. But, I guess I'm worrying about in TANF reauthorization coming up this time. Let's be very careful about trying to make states report things that, we would have a great deal of difficulty coming up with, even though we would like to. And I think, as I recall from the last time, we had proposed things like random surveys or using census information. I don't know how good, our researchers feel that those sources are compared to state data, but, there are some real-life consequences to having states collect a lot of stuff that, again, we might like to, but there's some real challenges there. So, Mike and Dimitra, I don't know if you feel like there are other sources that are as good, perhaps, as state data or not, but I guess we have a little bit of trepidation coming into the next round as we look at that issue.
Mm-hmm.
Quick comments?
I guess I would just say I'm not going to try to speak for the federal government on this issue, but as I think about the data that states are collecting, I think states definitely should be asking themselves the question: are they using the data that they're collecting? And because it seems to me that what you're collecting ought to be useful to you first. And I would tend to think that what the federal government issues is actually a subset of what you need to run your programs. And so it seems to me the first question always in data collection is having a real need for what you're collecting. And if you don't have a real need for it, actually, it ends up not being very useful anyway. I mean, it tends to be garbage. Because if you're not using it, then there's no feedback loops involved in what you're collecting. No one pays any attention to it. You pass it up the line. Someone thinks it's real, but it's not. So I have a real strong belief that data needs to serve the user as close to the ground as possible, and that others take advantage of that down the road, but not the other way around.
Other questions?
Hi, my name is Erica. I'm with the state of Florida. And first, thank you for being here this morning. It was a very wonderful panel, and I concur with your statement on using data. I come from a state that actually collects a lot of data and uses that data in its very regular practices. For example, workforce produces a lot of information. We use it in our training, monitoring, preparing materials, policies, and we partner very closely with the Department of Children and Families. We have a very good relationship, and it works out very much to our benefit in the state of Florida. As we prepare for reauthorization, and I guess this is not just to the panel, but also to all of the states and the researchers who are in the room, yes, we have had a significant caseload reduction, and in that sense, TANF reform or welfare reform has been very successful. But I think we're beyond that phase, and we're in the next phase of welfare reform, and where we're engaging individuals and bringing families into self-sufficiency, which expands so far beyond the receipt of cash assistance. It goes into diverting customers, helping families stay employed, get better jobs, and accessing services that they need to do so. And the question is, as we begin to approach welfare reform, using the data that we have and taking some of the data that we need to pose questions to prepare for where we're going to go with the law, especially with the administration's really significant focus on evidence-based program development. Mm-hmm. Okay, that being said, what kind of research are we really going into now to prepare for some of the concerns that the states have. If, for example, I think a lot of states are very concerned about participation rate. Does participation rate really lead to employment? Are people leaving at a higher rate of sanction than employment? Are people leaving at a higher rate of service engagement, like transitional services, or are people leaving because they don't want to participate anymore? How successful are the workforce programs? And a lot of that, whether it helps our program or not, could really shape the programs of the future in using TANF dollars. And I'm kind of not seeing a lot of that looked at. And so the question is, are we preparing to gather the material and ask those types of questions so that we really can shape the welfare programs of the future?
Excellent question. Any 20-word answers?
I have a 20-word answer that I think that, to me, one of the things that needs to be done is to do more analysis of cross-program participation.
That's
and,
20, by the way.
States are in a position to be able to do that. So it's not only the TANF, but food stamp and child support and child welfare and the workforce programs, all of those together.
It's hard to do it in 20 words. No, I think great question. I think, and when I worked for the federal government, I was an advocate of requiring just a little bit more reporting by states. And as a state person, I'm probably a little bit of an outlier on that. But I understand that our state has some capacity that would be hard for some other states. But I do think it's an important issue not to ask states for things that we're not going to use, right. And also to look and see, are there better ways? I mean, as we expand now with the American Community Survey, having some more capacity and other tools, we need to look carefully and see what's the best source of information and what is reasonable for states to do and what can we get from someplace else. But I would caution my colleagues from states, think about funding sources like SSBG that have not been able to successfully say what results are being produced for that, and the stress that puts you on, that if we're going to ask the Congress for continued or perhaps even increased funding, we need to be prepared to say what's resulting from those expenditures. And if we're not prepared to say that, then we're going to be at greater risk.
One last question.
Good morning. I'm Donna Gunter from Georgia. And I think it's more probably a comment and maybe, help as far as from the research end. But just wanting to piggyback on the conversation we were having about the safety net and about TANF being a safety net, and wondering if it's a matter of perception at this point as far as what I think, as Mike said, what do we want TANF to be? Is it really a safety net at this point in time? A lot of conversation here has gone on about TANF, the safety nets, and TANF being in that picture. And I don't think that we give a broad picture of what TANF is at this point. And knowing that TANF is a safety net at this point, but with a carrot. Because when you're coming on TANF at this point, there's the work participation rate. And so many times I think we're thinking of it as a cash assistance benefit for families, but it's families having to come in to do something to get this cash benefit. And so do we consider that when we're talking about the whole picture of a safety net in a state? Because I can get UI benefits, and yes, I have to do job search and stuff like that, but nobody is watching over me necessarily or holding me accountable for it. But if I come in for TANF, I've got to do something, and there are people holding me accountable. And I know in Georgia, the benefit isn't that big. So, is it necessarily worth it for me to come in to get this safety net versus looking at some other things? So I was just wondering if people consider that perception and in that conversation with researchers when we provide that as the safety net.
I think absolutely we have to think of that. But I think that the TANF funding and the TANF block grant is a more important part of the safety net than the cash assistance part.
And I was just, the only thing I would add there is that, more and more, there's no longer, you can't talk about a TANF program anymore in reality. There's 50 TANF programs or 51. I mean, it's so different from state to state as it's been defined and the role it plays within, quote, the safety net in that state. And that really does become a big challenge as you think about TANF going forward, it seems to me.
Last comments?
No, I think we're looking forward to learning more and appreciate
And talking more.
talking more. And no, I think that we've learned a lot, and I think we need to take stock of the fact that we have learned a lot over the past number of years. And I think that as we go forward and ask hard questions about things we don't know, that we have an important base to build from. And I think that's just something we need to keep in mind also.
I'm really challenged by the need to try to get my state legislature's attention on TANF reauthorization.
It's just not important.
And look forward to working with a lot of people in this room to help me do that.
Thank you.
So I want to finish with two things. Anybody who can help me figure out the effect of eliminating TANF-specific employment services, come talk to me, please. And then lastly, I would like to thank the panelists for coming up and doing something different in front of a big room of really informed people. So thank you very much.